positive, 50% of the time it will be a real positive, and 50% of the time it won't be. And that's why we're really asking people to start testing in among the first responders and the healthcare workers that may have had the greatest exposure, because that's where the test will be most reliable. And then when we have the luxury, we can go out to broader and broader communities. But this has been the fundamental question to begin with and has been persistent. And we will emphasize to the American people again, this is a highly contagious virus. And we don't know by looking at someone whether they have pre-existing conditions or not. And so all of us, as far as protecting others, must continue to do all of the recommendations to ensure that when we are in an asymptomatic state, we're not passing the virus to others.
I have a question for you as well. The governor of South Carolina announced today they're going to open some stores with restrictions, but they just told my colleague Natasha Chen that they have not achieved that criteria in the White House guidelines about the downward trajectory for 14 days. So shouldn't they not be reopening stores today?
We have asked every governor to follow the guidelines, just as we've asked every American to follow the guidelines put out by the president. But each of the governors can decide for themselves whether they've reached specific guidelines in specific areas. I had a question, I think, on Saturday about Jacksonville and their beaches. So I did spend about 5 hours going to every state website, and I will tell you that the Florida Department of Health website is extraordinary, and this is what every Department of Health should have, because when you go to that website, you can see that most of the cases are in southern Florida, in the Miami, Fort Lauderdale, Broward County area. And if you look in Jacksonville, they had less than 20 cases per day and less than 800 in 4 weeks. And so these are the kinds, when you inform the public and give them the information that they need, then they can make decisions along with the local government and governors. So I'm not going to say specifically with South Carolina because I don't know their specific website right now, and I don't talk about data unless I've seen it myself. But I know from Jacksonville that they had less than 20 cases a day. And so this is how we need to start informing the community. These websites are critical. It's by zip code and it's by county. They can see cases, they can see cumulative cases, they can see new cases, they can see hospitalizations, they can see mortality, they can see age groups of mortality, and they can see where every testing piece is. This is how we have to inform the American public, and this is where the American public will develop confidence in each of their counties and local governments.
I was hoping you can comment. The Vice President mentioned that there's enough testing capacity right now to proceed to phase 1. But what about phase 2 or phase 3? Are there enough machines, or enough cartridges, are there enough reagents right now for the sort of reopening that the administration is envisioning taking place over the next month or two?
So you can see the current machine outline, and you can see that both of these gentlemen have prepared to have everything ready for phase 2 and preparing it now for what we will need in the future. And I think that's what you saw with the ventilators. That's what you're seeing with PPE. It's not just for today, it's for tomorrow. And it's our federal planning is not just for this instant. It's making sure that we meet the needs of this instance, but we're planning for 30 and 60 and 90 days ahead.
I would just agree with Dr. Birx completely. We are ready right now to enter phase 1, and we are ramping up all our capabilities across the board, not just to achieve what's necessary for phase 2, but 2x, 3x, 4x, so that we will be absolutely over-prepared when the nation is ready to go into those phases.
President Trump.
And by the way, not everybody agrees that we have to do that much testing. We're going maximum. You understand, there are some people who don't want to do that much testing, but we're going maximum. We're going to the outer limits, and I think that's the way probably it should be. Jeff, go ahead.
Mr. President, to return to a topic that you opened the press conference with on oil, U.S. crude futures today went below zero, went into negative territory.
Went negative.
Yeah.
Like interest rates, they go negative.
Does that make you want to see Saudi Arabia and Russia and OPEC Plus do more
Well,
to
it's for
reduce
short
supply?
term. Much of it has to do with short sellers. Much of it has to do, if you look a month into the future, I think it's at $25 or $28 a barrel. So a lot of people got caught. They got caught, and there are a lot of people that are not too happy because they got caught. So if you take a look at it, you'll see it's more of a financial thing than an oil situation. But because you take, I believe, in a month or so, in other words, go a little bit out, it's at $25 and $28 a barrel. So it's largely a financial squeeze, and they did get squeezed.
So would you like to see, however, Saudi Arabia and other countries make more
Well,
cuts?
we've already done that, where Saudi Arabia's cutting back, Russia's cutting back, Mexico's cutting back, and the OPEC plus, they call it OPEC, plus additional states are cutting back. And, you know, the problem is nobody's driving a car anywhere in the world, essentially, 184 nations. Factories are closed and businesses are closed. And so all of a sudden, we had really a lot of energy to start off with, oil in particular. We had a lot. And then all of a sudden, they lost 40, 50% of their market. So it just stopped. So it's going to be picking up, and the energy business will be strong. But they cut back. It could be 20 million barrels, but it's, let's say, 15. And that was between Russia and Saudi Arabia. But this had to do with the squeeze, and it was a very tough squeeze. A lot of people got.
I don't think they need to do more right now.
Well, they're going to do more by the market, to be honest. Look, same thing over here. If the market is the way it is, people are going to slow it down or they're going to stop. That's going to be automatic, and that's happening. Yeah.
Mr. President, on criminal justice reform and these SBA loans, I got an email earlier this morning from a fella in the Northwest who owns a supply business. And he has a felony on his record, nonviolent felony, in the past 5 years, which under SBA guidelines makes him ineligible for one of these PPP loans. So he has now had to let go 50 employees, many of whom are criminals trying to get back into society. I don't believe there's anything in the CARES Act that would restrict.
If you give me the name of the company and his name, I'll have that checked out, Joe. I'll do that. It's a friend of yours?
No, not a friend of mine. No, it's just somebody who
Why did
contacted
he
me
call-
out of the blue.
He called you to say he's a criminal, and why did he get a loan? Or
He
what's...
says he wanted to apply for an SBA loan and couldn't, and wondered how that squared
Okay,
with
if you
your.
give me the
your-
name, I'll look into it. I'd like to look into that, okay? Caitlin, go ahead.
If these companies that open and they have employees come back to work and they get sick, will these companies be liable?
Which companies are you talking about? Under
Any
what?
companies that open, manufacturing, any kind of company that opens,
So
employees
we-
go back to
we
work,
have-
they get sick, will the
I'll
company
give you
be
an
liable?
answer to that. I'll give you a legal answer to that when we look it up. But we are trying to take liability away from these companies. We just don't want that because we want the companies to open and to open strong. But I'll get you a legal opinion on that. I'll get you, well, that's what I'm saying. I'll get you a legal opinion on
You
that.
guys haven't discussed that yet?
Nobody's discussed it, no, but we will now.
Have any business executives have voiced concern to you about being liable
Not one,
potentially?
not one.
They didn't say
Not
that
at
on the
this
call
point,
last week?
but we're gonna look because they have talked about general liability. So I'll get you a specific answer from the lawyers, okay? Go ahead, please.
Thanks, Mr. President. I wanted to follow on oil. When you were talking earlier, you were talking about the PPP deal and then mentioned the SPR. In the first stimulus package, even though you had announced
Well,
that
but you know the price of oil right now, don't you?
I do. Do you know the
I
price
do.
of oil?
I actually do.
It's negative
I actually do.
$37.
Of course,
Yeah.
nobody's ever heard of negative oil before, but it's for a short term.
In your opening remarks, you were talking about the PPP deal, and then you mentioned the 75 million barrels of oil that,
Yes.
that you previously had said you wanted to purchase.
Yes.
You weren't able to get funding for that in the first deal, so I'm wondering, are you?
Well, at the price you're talking about, you don't need funding. They pay you, see? You know?
If you can go get it
Because right
in the
now,
next
if you can
24
get it,
hours,
that's
yeah.
true, if you can get it.
So my first question is, are you asking for that
Well,
funding
at a
as part of
minimum,
the
we'll let
PPP
people
deal?
store, so we'll store it, we'll use it as storage, and charge for it. But people need storage desperately, and we have massive storage under the petroleum.
So you're not going to make it a requirement of the PPP interim funding deal?
It's
that's
not a
going to be
question of
there?
requirement. If we could buy it for nothing, we're going to take everything we can get. The only thing I like better than that is where they pay you to take the oil. But that's a short-term squeeze. You understand that. So I don't think you're going to see that. But no, we'd like to have Congress, this is a great time to buy oil. And we'd like to have Congress approve it so that we could, instead of just storing it for usually the big companies, because I think we have 75 million gallons right now capacity. That's a lot. We've been building it up over a period of time, but that's a lot, 75 million barrels. So we're going to either ask for permission to buy it or we'll store it. One way or the other, it will be full. Okay, please.
Mr. President,
Go ahead.
sorry,
You
yeah.
finish up. We'll go right to you.
Yeah, some senators, including Senator Kramer, have called on you to stop Saudi oil shipments that are on the way right now. Is that you can do that under Section 232? Is that something that you would consider?
Well, we'll look at it. I heard just as I'm walking into the room, we certainly have plenty of oil. So I'll take a look at that, okay? Yes, please.
Question. First on testing, the second on the SBA loan program. When will you in fact invoke the DPA to force that company you mentioned to ramp up production of
Well,
medical swabs?
we really don't need it. We use it, we go up, and I've used it a lot. But we use it, and then sometimes all they have to do is see it coming. Do you want to talk about that, Admiral, please?
I think this is, I don't think any of us knew very much about the DPA, but there's sort of a force side of the DPA where you force a company to do something, but there's a second side of it which is really a hand up. The company we're talking about has done everything to support this effort and have ramped up production. I'm on the phone with them multiple times a day. This is the hand up. This is the government coming in and saying, how can we help you expand your lines? There's no asynchrony here at all. So this is the hand up side of the DPA, which is exactly what these small American heroic companies need. They don't need to be forced. They're all in. Their employees are all in.
So point of clarity.
And we don't want to embarrass people either. Please, Brett, go ahead.
So today we were on site, or there were folks on site with that company finishing out what their capital projections will be in order to be able to ramp up these additional 4 lines that I spoke about. The company will then turn in a white paper to the DoD that will then help move the process forward, but it's actively in process.
And I fully understand that the need is enormous, but on March 21st, the administration promised 27 million tests by the end of March. So far, roughly 4 million people have been tested. So where are the other 23 million or so tests? Do they not materialize? Are they in the pipeline? Help us understand that discrepancy.
So since I was the one who said that, let me explain where we were. So I was getting my information, it was correct information about the actual tests that are in the marketplace. So if you want to use those metrics, there's been over 40 million, quote, in the marketplace. But we have an end-to-end issue that we needed to deal with, and that's what we've been dealing with. The swabs, the transport media. If we don't have people utilizing the machines the way Dr. Birx is talking about, we have some of our main platforms that are only 10% being utilized. You could have a lot of tests in the market, and those are correct numbers. But if the machines aren't utilizing them and they're not organized at that level, then they're not being utilized to its fullest.
So
and that,
you meant if the machines were utilized, that would be the
you would have a lot of those millions of tests already being done. I think Ambassador Birx has estimated that we have another 1 million tests a week just on one platform that could be done if the machines were utilized more fully.
Question for Admiral Guerrero.
For this?
Admiral Guerrero, you say that there, and the Vice President has said this, Mr. Smith said it, that there will be enough tests in place for phase 1. There are. The question is, what's the standard of testing that you now have the capability for? Is it to test people who are only very ill? Is it test people who have the sniffles? Is it test people who come in just because they want to get a test? I mean, what is the standard here? For
It is the guidelines, but I tried to be a little specific about this on Friday, and we all tried to. Number one is you need to test everyone who's symptomatic, right? And you need to over-test them because
How symptomatic?
we're talking any symptoms that would be consistent with COVID, right? So, and there's a wide range of symptoms. You want to test them, and you want to over-test. And we talked about the approximate metric with Ambassador Birx fully supports, because this is a good metric that you want to get about 1 positive for every 10 tests. Then you oversample. Second, and this is a really important part of the strategy, is because so many people are asymptomatic, there's no way that you can test enough people to pull one asymptomatic out of 300 people in the population. So the strategy with Ambassador Birx offered, and I talked to epidemiologists around the country, and they go, wow, I wish I would have thought of that, is to really focus on the vulnerable population where we know that the asymptomatic rate could be much higher than the rest of the population. And we are going to be focused, and this is what my office does during normal times, focusing on the underserved populations, particularly in inner cities and urban areas. They have a higher rate because overcrowding, they can't telework, they're subject to a lot of comorbid conditions. Nursing homes. We all know about nursing homes, and there's both symptomatic and asymptomatic spread. And finally, some of our indigenous populations in the Indian Health Service. So this is a very, very important layer that most of the models and people don't talk about, because that's where we're going to pick up the asymptomatic carriage. And when you do that, that's when you focus on track and trace.
So just a quick follow-up on that. If we have enough tests right now for everyone to go into phase 1, why is the governor of Maryland having to get 500,000 tests from South Korea?
I don't know what the governor of Maryland is doing in South Korea, but there is excess capacity every day. If he wanted to send 30 or 40,000 tests to LabCorp and Quest, that could be done. That could be done tomorrow.
Enough that they needed to start to up their testing capacity and make it adequate. So
I
they
think
had to
I
have
think
these
we're seeing
late-night
all
meetings
across the country
with South Korea.
that in the states that have been hardest hit, their capacity, not only their capacity, their testing far exceeds South Korea. And they've been able to do that on a relatively straightforward basis. I don't know what the governor of Maryland, we talked to him today, he didn't bring that up today. We were on the governor's call today.
But you haven't spoken to him like personally on this?
Go ahead, Mike.
We spoke to Governor Hogan today. I'll follow up because I heard there was an announcement today about that he had acquired some tests from overseas. Maybe we could put the slide back up that showed the number of facilities just in the state of Maryland. And part of our process, and I don't know when the governor placed the order from South Korea, wouldn't begrudge him or his health officials for ordering tests, but the capacity of all the different laboratories and the number of machines that are across Maryland is part of what we were communicating today, including federal facilities. NIH is in Maryland, there's Department of Defense facilities, and what we assured the governor then, and we assured all the governors, is that we'll open up all of those facilities. But John, back to your point, there was one other element of that, that's the phase 1 testing, and I can't really describe it as well as the doctors here, but it's the contact tracing piece. We really believe that states that meet the criteria of 14 days of cases going down and proper hospital capacity, if they test people that have symptoms, and if they deploy resources to vulnerable populations, nursing homes and other designated vulnerable populations where we believe the threat of serious outcomes from the coronavirus is real, then we also today inform the governors that we will be deploying CDC teams to every state and every territory in the country to assist them in contact tracing. Governor Jared Polis raised a very good point about the legislation the president is currently negotiating on Capitol Hill. He recommended that we make sure that the new bill that has some $25 billion in testing resources also cover contact tracing expenses by states. We assured him our administration strongly supports that. We communicated that to the Secretary of the Treasury and the rest of our negotiation team, and we'll be pursuing that. But we were able to tell every one of the governors that we will be deploying teams, we think of 10 or 12 for a start, from CDC to reside in all of our states and territories to supervise and work with contractors and others to do the kind of contact tracing. So it's test people that don't feel well and may have the coronavirus, keep a careful eye and monitor your vulnerable populations, and when you come across a case, have a team on the ground that can do the immediate contact tracing and testing, and that's how we restrain and contain the spread of the coronavirus during phase 1, and frankly, it's the beginning of the structure for how we contain the coronavirus going forward.
And take a look at that map. The governor of Maryland could have called Mike Pence, could have saved a lot of money. Look at these different places. That's Maryland right there. So could have saved a lot of money, but that's okay.
To go to South Korea for
No, I
this
don't think he needed
testing
to go to
kits?
South Korea. I
But
think
you
he
guys-
needed to get a little knowledge would have been helpful.
On the
Yeah.
SBA loans, do you think it's right that major corporations, major institutions like the Ruth's Chris restaurant chain like Harvard University apparently got a lot of money under the CARES Act, money that was supposed to be earmarked for small business owners? Do you think that's fair?
Well, I know
And
one
if-
thing, I didn't get any. That's for sure. I didn't get any. We'll look at individual things, and some people will have to return it if we think it's inappropriate.
But should the criteria be changed so that money goes to people who need it?
Well, it's being done by great professionals. It's being done by banks, and as you know, community banks all over the country. That's what they do. They loan money, and they're supposed to do it according to not only criteria, but according to what we think is right. But if somebody got something that we think is inappropriate, we'll get it back. Okay? Good point. Please, go ahead.
Yes, a different question about South Korea. There are reports that you are personally negotiating with President Moon the terms of reduction of U.S. forces on the Korean Peninsula, and that there are 4 scenarios involved. Can you confirm that? And if so, what is your desired outcome?
Well, I think that South Korea had a great talk with President Moon. He's a friend of mine. I congratulate him. He had a wonderful election victory. I was very happy about that. He was, as you know, just recently. We are negotiating for President Moon and for South Korea to help us monetarily, because we, as you know, we have 32,000 soldiers there. That varies from 28 to 32,000 in South Korea. And we think that before I came aboard, they paid very little, if anything. So we're defending a wonderful nation, a nation that we have great relationships, but we're asking them to pay for a big percentage of what we're doing. It's not fair. So it's not a question of reduction. It's a question of will they contribute toward the defense of their own nation. We're defending nations that are very wealthy. South Korea is a very wealthy nation. They make our television sets. They make ships. They make everything. And I give them great credit. We've been defending them for many, many decades, as you know, over 8 decades. And I've gone to them in the past. Last year I went to them, and now they're paying $1 billion a year. And I went to them again. I said, look, I'll be back, because that's just a fraction. And again, the relationship is great, but it's just not a fair relationship. We renegotiated the trade deal and made it a much more equitable deal than it was in the past. It was a terrible deal. It was done by Hillary Clinton. It was a terrible deal. The new deal is a much more equitable deal. That's on trade. But on the military, I mean, we're paying for the military to defend another nation that's 8,500 miles away. And they're not the only one I'm talking to, by the way, as you know. I won't go into names, but I've done this. Nobody talks about it, but I think it's appropriate. I think the taxpayer of our country, taxpayers want to hear these things. And so now they've offered us a certain amount of money, and I've rejected it. I just said, it's just, look, you know, we're doing a tremendous service. We have a wonderful feeling and a wonderful relationship with each other, but we have to be treated equitably and fairly. And so that's where it is right now. And what's going to happen, I can't tell you, but we'll find out fairly soon. But I congratulate the president, who's a friend of mine. I congratulate President Moon on having a terrific victory. Please, sir.
Thanks, sir. A question for you about Governor Cuomo's visit, and then also a question for Dr. Birx, if you'll let me. The New York governor, along with the National Governors Association, in the past have called for aid to be unrestricted. As a lot of state and local governments see their revenues drop, are you open to the idea of unrestricted aid, or do you want it to be pandemic specific?
Well, we're going to be talking about that in Phase 4, as you know, which will start very shortly. And that has to do with infrastructure, hopefully infrastructure, because this country needs infrastructure. We spend all this money in the Middle East, $8 trillion, $8 trillion with a T, dollars in the Middle East. But if you have a pothole in a highway someplace, they don't want you to spend the money to fix it. How stupid have we been in this country? How stupid have we been? And that's changing rapidly. You know that. You've seen that, including things like negotiating with friends. But when we are helping friends, friends should reimburse us for the cost. I mean, why should we be defending nations for free? We're defending a nation for free. Now I'm getting $1 billion a year, and we were offered much more than that, but I turned it down. So that's where we are with that. As far as the other is concerned, look, we have to be smart in this country. We've been taken to the cleaner by and I mean with allies, not just with the enemies, with allies. Frankly, the allies have taken us much more so than the enemies. The enemies we don't do business with, right? The allies we do business with. And whoever made these deals, whoever made these contracts, in many cases, we didn't have a contract. Like, we didn't have a contract, we didn't have a trade deal with China. They came in and they took $500 billion a year for many years, but anywhere from $200 to $550 billion a year out of our hides. Now we made this great trade deal. Unfortunately, that was a number of months ago. and it's a great deal. They're paying 25% on $250 billion. A lot of things are happening. They're going to have to purchase $250 billion worth of goods, including farm product, up to $50 billion. So a lot of good things are happening. But then what happened with China was the plague hit us, right? The plague. That was after. This was long after we signed the deal. The plague hit us. So I'm not happy about that. Okay, John, please.
A question for Dr. Birx, if I could. Dr. Birx, a question on the virus itself. As it passes from patient to patient and mutates, over time, have you picked up any indication that it has become less virulent? Have you picked up any indication it has become more virulent?
You know, that is an excellent question because we watch that all the time, particularly with RNA viruses, to really track its adaptation to humans. I mean, you're really asking, has this virus become more adapted to humans and more able to spread, or is it becoming less adapted to humans and less able to spread? We don't have any indication that it's less able to spread, and we'll have good analyses that will come from. Obviously, the Roosevelt had its incident with a virus outside of the United States, and we'll be able to look at those parameters. And the DoD and the military has done a great job in really ensuring the health of the sailors, but also ensuring that these questions can really be asked and answered. We have extraordinary evolutionary molecular biologists in this country, all around the United States, and they're looking at this very question. And a lot of the work that we've been doing, and you'll see a lot of work happening with testing in New Mexico and testing in other states. They have extraordinary molecular biologists that are evolutionary biologists, and they'll be able to look at that both in New Mexico that may have lower transmission rates and compare that to New York that has maybe 10x the transmission. But it's an excellent question, and it's something that will be able to be answered by what we see in the United States.
John, what a good question that was. Where did that come from?
Once in a while, I pull one out of my hat.
No, that's very impressive. You know, when Senator Schumer wrote a letter a couple of months ago, and he said, you should use admirals and generals. I said, well, that's where first of all, we have our vice president has been incredible, but we have the admirals, we have the generals. And I was just talking to the admiral inside just before we came out. I said, did you go to Annapolis? He said, no, sir. I said, oh, that's too bad. That's too bad. Where did you go? He said, I went to Harvard. Oh, that's okay, too, I guess, right? So you went to Harvard, and he was a great student at Harvard, and he's doing a fantastic job. And this young gentleman was very, very successful, but he wanted to help the country. He wanted to come into the country, and we appreciate it very much. It was a big success, big success. Let's do here and there next, okay? We're all set. Good.
Thank you, Mr. President. I was hoping you talked about your meeting tomorrow with Governor Cuomo that you mentioned. Is there a reason he's coming all the way down here?
I don't know. He wanted to, and
that sort of travel
we, believe it or
essential?
not, we get along. Okay? He was very generous yesterday in particular. Said we did a, quote, phenomenal deal. I don't know if anybody wrote that, but he said that, and I appreciated it because it's not about me. It's about these people and thousands behind Mike and the Admiral and all of the other people that are working with us. I mean, and you see, look, I don't understand when I see polling and approval ratings for the job. I mean, this group should get a 95. It really should. And we're really helping the governors a lot. And the governors call me, the ones I know, or the Republicans, but the ones I know, and they say, it's incredible the job you're doing. Again, not me, the job this group is doing. And you sit here, and I'm watching from the corner, and I'm just saying, boy, it's incredible stuff. When you watch the general get up, General Semonite, and talk about boom, 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 you don't see that. You don't see that. When you hear the Admiral speak about the testing, how good it is, and yet people don't like to say it. But remember, it was all about ventilators a month ago. Ventilators. Then we fixed it. You don't hear about ventilators. Where is the ventilator? Jeff, you haven't asked about ventilators recently. What's going on? What about ventilators? We're helping other countries now because they can't have. They're very hard to come by, and they take a long time to make, like years. It's incredible the job they've done, that our people have done, and also private companies have done. You talk about the act. We don't like to use it unless we have to, but a lot of times just the fact that you have it gets you everything you need. So, we don't want to embarrass any of the companies, but we have used it on a number of occasions, and it worked, but it works just as well before you have to use it, because they don't want to be embarrassed, and I don't want to embarrass them because they've done a great job. Please, go ahead.
Thank you, Mr. President.
No, I think right behind you, I promised. I cannot tell a lie, so and we'll get you next, okay? We'll get you next.
Talking to her or me?
No, you.
Me, okay. Well, thank you so much, Mr. President. My question, I have two questions. The first one is on testing. You talked about the idea that first it was ventilators, now it's testing. You seem to maybe possibly be implying that talking about testing is a personal attack on you. Can you explain why you think talking about testing is a personal attack, given that the access to testing has been an issue for a long time? There's bipartisan outcry still today that there's not enough testing. Why do you think it's a personal attack on you?
Well, it's not bipartisan, it's mostly partisan, but more importantly than mostly partisan, it's incorrect. You have the experts. Look at these maps. I mean, you have the maps with so many different locations. In the case of, as an example, Governor Hogan, he didn't really know. It was very obvious to any of those listening on the call today, even though you weren't supposed to be on it. I'm sure that some of you were, or representatives were. He really didn't know about the federal laboratories. Would you say that's correct, Mike? He didn't know. He didn't know. And Mike doesn't like to get into this stuff. He's less controversial than I am. But he didn't know about it. And if he did know about it, he would have been happy. No, we've done a really good job in testing. Now, with that being said, we have tests coming out perhaps over the next 2 weeks that will blow the whole industry away. Now, a lot of people love the Abbott test. So do I. You know, the Abbott test is great because it's boom, they touch, they put it in 5 minutes you have. The problem is that doesn't do massive numbers like the big machine. But the big machine takes a day and a half, you know, with delivery and everything else. But we have tremendous testing capability. Remember this, we've tested more than any country in the world by far. In fact, I think I read where if you add up every other country in the world, we've tested more. But remember this, we're dealing in politics. We're dealing with a thing called November 3rd of this year. Do you know what November 3rd represents, right? You know better than anybody in the room. November 3rd of this year, it's called the presidential election. No matter what I do, no matter where we go, no matter how well we do, no matter what, if I came up with a tablet, you take it and this plague is gone. They'll say, Trump did a terrible job, terrible, because that's their soundbite. That's the political soundbite. They know the great job we've done. But with all of that being said, and also there is a thing that somebody could talk to if they want, but I don't want to bore you with it. Not everybody believes we should do so much testing. You don't need so much. We're talking about maximum. The reason that the Democrats and some others, maybe because they don't know, they want maximum because they want to be able to criticize. Because it's almost impossible to get to the maximum number, and yet we've been able to do it already. But with that, and you'll be seeing this over the next couple of weeks or sooner, we have a test. If it comes out, it'll revolutionize the whole world of testing. It'll be something really special. So I don't view it as personal at all. What I do say is it's something that's not fair to thousands of people that have done such a good job.
The second question is about your language and how you approached the coronavirus at the beginning. I interviewed someone who said that his family got sick. They went to a funeral in mid-March. And they said mainly because the president wasn't taking it seriously. He said, if the president had had a mask on, if he was saying we should stay home, then I would have stayed home.
Well,
Instead, I have family members. He said his family members were sick, and because they were listening to you. Do you feel like, or are you concerned that downplaying the virus maybe got some people sick?
And a lot of people love Trump, right? A lot of people love me. You see him all the time, right? I guess I'm here for a reason, you know? To the best of my knowledge, I won. And I think we're going to win again. I think we're going to win in a landslide. But just so you understand, you're talking about March, right? Yeah. And yet, excuse me, I know, I understand. And yet in January, a certain date, you know the date better than I do, we put on a ban of China where China can't come in. And before March, we put on a ban on Europe where Europe can't come in. So how could you say I wasn't taking it seriously? You know, I put on a ban on China before anybody in this country died. I put on a ban. And so you tell me, Nancy Pelosi she wanted to have a street party in Chinatown in San Francisco at the end of February. That's a month later. And then they tell me it's only a political talking point, but you feed into it because you're too good a reporter to let that happen. Really, you are a good reporter. You're too good a reporter to let that happen. Remember this. So at the end of January, I put on a ban. People that were in that room will tell you, I think there were 21 people. I was the only one in the whole room that wanted to do it. Fortunately, I was the one that counted for that purpose. We put on a ban because I was reading bad things about China. World Health Organization should have told us. But I was reading it with or without them. They should have known. All they had to do was read it. They didn't have to even be there. But they tried to cover up for China. World Health covered up for China. But no, wait. But you can't say this. Look, I put on a ban. In other words, I stopped China from coming to the United States. I stopped Europe from coming into the United States long before the March date that you're talking about. So people should say I acted very early. That was a very hard thing to do. Doing that was a very hard thing. I didn't want to do that, but I did it because I thought, and Dr. Fauci said that by doing it, President Trump saved tens of thousands of lives. So I did take it very seriously.
Rallies in February and in March, and there are some Americans.
Oh, I don't know. I don't know about rallies. I really don't know about rallies. I know one thing. I haven't left the White House in months, except for a brief moment to give a wonderful ship the comfort.
You held a rally in March.
I don't know. Did I hold a rally? I'm sorry, I hold a rally. Did I hold a rally? Let me tell you, in January, when I did this, you had virtually no cases and no deaths, and yet I put it on. So how could I not? Why was Nancy Pelosi, right? Nancy Pelosi is holding a street fair. She wants a street fair in San Francisco in Chinatown to prove, you know what the purpose of it was? To prove that there's no problem. Many other politicians did the same thing and wanted to prove. While I was, no, of course not. No. I've been, people are amazed at how early I acted, and I did act early. With that being said, it's very hard to say, let's close down the greatest economy in the history of the world. I had to close down, I and everybody else that works with me and 300 and close to 350 million people built the greatest economy in the history of the world. Best employment numbers, best stock market numbers, best numbers in virtually every category, even good manufacturing numbers. The previous administration said manufacturing was dead for our country. Even great manufacturing numbers. And you know what? I did that, and somebody walked into my office and said, sir, you're going to have to close down the economy. You're going to have to close the country. But you know what I say to you? We're going to rebuild it. And we're going to rebuild it better, and it's going to go faster than people think. I built it once, I'll build it a second time. Please.
Mr. President, thank you. Shall we on the floor, America?
Please.
Go ahead. We have, going back to the topic of friendship and bipartisanship, Americans, with the exception of Pelosi, Schumer, and even Romney, Americans have seen an unprecedented chapter of bipartisanship and cooperation on the political landscape. On a personal note, what has been the most significant signal that your relationship with Democrats below the leadership level have changed for the good of America?
I think it's a great question because there is bipartisanship. Look, we're getting the paycheck plan. It's already $350 billion was approved, essentially unanimously, and we have another 250, which I think you're going to find out is going to be a higher number than that. Okay, I won't say it now because I don't know if they've released it or not, but it's going to end up being more than 250 billion. And this is going to small businesses and it's going to workers. And these are really bipartisan plans. It's a great thing that's happening. So I think the fact that we're able to do all of this in a bipartisan way is great. Now, the tax cuts that the Republicans did, we had no help from the Democrats, so you can't say that's bipartisan. But this whole thing, getting our country back, and, you know, Nancy Pelosi's been, she's very nasty. She, you know, wasted a lot of time on a impeachment hoax. It was a total hoax, went nowhere. And that was not good. And Schumer, I guess it's the same thing, but he sort of accepted it. He just did what he was supposed to do, and he didn't do very well with it. But, you know, that was not appropriate. That was a bad thing for our country. But it was fine. I mean, I understand the game. They have a little bit of a majority, so they say, let's do something and let's try and stir it up. But they wasted a year. They wasted tremendous. We could have been doing things that would have been great for our country. They could have been looking into China. They should have been looking into China as an example. A lot of people are blaming the Democrats for wasting all that time because it was during that period of time, as you know, that it was fomenting. But I think we've had a great spirit of bipartisanship in a certain way. It's not, I wouldn't say we're going to set records throughout the world, but things are happening that are very good. The country is coming together. And I'll tell you what, the people are coming together. The people are really coming together. I think you're going to find that our country is much more unified. I do think that the press, the media, foments a lot of this, a lot of anger. I really believe it foments tremendous anger. For instance, I'll be asked a tremendously hostile question from somebody, and then I'll answer it in a hostile way, which is appropriate. Otherwise, you look foolish. Otherwise, it looks like just walk off the stage and bow your head. I can't do that. You know, I just can't do that. But a lot of these questions that are asked from certain networks are so hostile, and there's no reason for it. There's no reason for it. We are in a war. This is a World War II. This is a World War I, where, by the way, the war essentially ended because of a plague. That was one of the worst ever. They lost almost 100 million people. But we're in a big war. And I'll say one thing about, because I think it's important. The last person, I did it early, but I was the last person that wanted to close down one of the great economic, you can't call it an experiment, but everything, I guess, in life is an experiment. So I'd say experiments, but one of the great economic stories in history. I'm the last person that wanted to do it, but we did the right thing. Because if we didn't do it, you would have had 1 million people, 1.5 million people, maybe 2 million people dead. Now we're going toward 50, I'm hearing, or 60,000 people. One is too many. I always say it. One is too many. But we're going toward 50 or 60,000 people. That's at the lower, as you know, the low number was supposed to be 100,000 people. We could end up at 50 to 60. Okay, it's horrible. If we didn't do what we did, we would have had, I think, 1 million people, maybe 2 million people, maybe more than that. And you look at, there's one country in particular that decided, let's wing it, let's just keep going. They are being inundated with death. Now, if you take a look at some of the hospitals where, one of them I knew growing up in Queens, and I'm looking at the bodies laying in hallways, being brought into refrigerated trucks, the trucks, these massive trucks, bodies going in. Multiply that times 10. It's not sustainable. And many of the people that have this theory, oh, let's, you know, maybe we could have just gone right through it. I was somebody that would have loved to have done that, but it wouldn't have been sustainable. You can't lose 1 million people. That's that's almost double what we lost in the Civil War. I use that as a guide. Civil War, 600,000 people died. So it's not sustainable. But it could have been much more than 1 million people. I mean, if you took a number and cut it in half and half and in half again, you'd end up at 500,000 people, okay? If you want to make a very conservative guesstimate. 500,000 people is not acceptable. Is that a correct sort of an analogy? So, I mean, I see it all the time by friends of mine, by people that I have great respect for. Well, we could have done this, we could have done. And remember this. When we say 50, and they compare 50 to the 35 of the flu, because it averaged 35, 36,000 over a 10-year period, it's a lot. Who would think that? But we're not talking about, with the flu, that's just, it just goes. We're not locking ourselves in our units. We're not locking ourselves in our apartments and not moving and not touching anybody and just saying, you know, the world. In this case, we are. And we're still going to lose between 50 and 60. But if we just kept it going on a normal basis, which is really the only standard that you can compare it to with the flu, because that was a normal basis. You get into an airplane, you travel to Florida, you go to Texas, you go wherever you're going. But in this case, if we didn't do anything, the number wouldn't be 50 to 60,000. The number would be 1 million people dead. It would be 1.5 million, 1.2 million, maybe 700,000. It would have been a number in like that because, and it's so important because I see so much. Oh well, you know, you can't compare it, because I'll tell you what, the people of this country, what they've done, they've gone out of what they had, the way they've lived. It's not great. It's terrible. Maybe the first 3 days, and then all of a sudden, you see what's going on. They want to get going, And I get that fully. But I just say this. If we would have done that, we would have lost anywhere from 1 million to more than 2 million people. Now, with all of the death that we've seen at 50 or 60,000 people heading toward, right now it's at 40, but 50 or 60,000 people, probably over 50 for what I see. But that's with our guard up. If we took our guard down and just said, okay, we're just going to keep this open, we would have lost millions of people. Can you imagine? Look how bad it looks now when you look at the bodies, when you look at Hart Island in New York where they have the mass grave and all of the things that you see. Can you imagine if we had the guard down, if we didn't do anything and we just said, let's ride it out? It would not have been sustainable in any way. It would have been an atrocity. So we've done the right thing. We've really done the right thing. And the people that have worked so hard and dangerously, I'll tell you, again, I say it, but I watch those doctors and nurses and medical people running into those hospitals, and they don't even have their gear on. Forget about gear, whether it's great gear or not, and we're bringing in the best gear in the world. But they're running in with open everything, and they're the job. They're like warriors, the job they're doing. But if we didn't do the moves that we made, you would have had 1 million, 1.5 million, 2 million people dead. So multiply that times 50. You're talking about you would have had 10 to 20 to 25 times more people dead than all of the people that we've been watching. That's not acceptable. The 50,000 is not acceptable. It's so horrible. But can you imagine multiplying that out by 20 or more? It's not acceptable. So it's a very good question. I appreciate it. We'll see you tomorrow. We'll see you tomorrow.
Can I ask you about Larry Hogan's response to what you just told me, Mr. President?
Mr. President, a question about children.
Thanks, everybody.